Which vaginal birth method, water or bed delivery, decreases the risk for obstetric anal sphincter injuries? Is immersion in water a good idea to prevent OASIS? Obstetric anal sphincter injuries are a big issue in the context of vaginal delivery and especially their prevention. OASIS are feared because of the increased risk of fecal incontinence, perineal pain and dyspareunia. These pelvic floor disorders may persist and reduce quality of life. Primiparae are known to have the highest risk for OASIS. It was shown that the use of warm compresses on the perineum in the second stage of labor reduces the rate of OASIS. On the other hand, water deliveries have become a popular alternative birthing method with subjective and objective advantages. These are less episiotomies, less use of painkillers, and a better birthing experience. In general, in a Swiss hospital, the management of water deliveries and bed deliveries is the same. This is crucial when we want to compare these two different birthing methods. In worldwide data, the interpretation of the rate of OASIS after water deliveries still vary widely. This is especially true as the management of the second stage of labor in water deliveries and bed deliveries often differs. So, for example, in water deliveries, a hands-off technique was used, and then in the bed deliveries, the hands-on technique was used. So the aim of our study was to compare the rate of OASIS after water and bed delivery by Primiparae. Especially interesting this is because data are still controversial. We supposed that immersion in water might have a positive effect on the perineum by providing pressure relief. Our hypothesis was that Primiparae with identical management of labor have the same rates of OASIS after water and bed deliveries. Between 1991 and 2006, 3,907 Primiparae were included into the study groups, all coming from a Swiss public teaching hospital. The management of water and bed deliveries was the same. For example, the fetal heart rate monitoring and the indication for the use of oxytocin or an episiotomy. All women had either a complete water or a complete bed delivery on their back in a slight upright position. The hands-on technique was used in all women to protect the perineum. OASIS were diagnosed by obstetricians and treated by them. All deliveries were documented by a specially designed questionnaire. Inclusion criteria were low-risk Primiparae at full term of gestation. All babies were in a cephalic presentation. Exclusion criteria were obviously preterm deliveries, instrumental or breech deliveries, but also epidural anesthesia. Coming to the result and having a closer look at our findings. The duration of the delivery as well as the duration of the second stage of delivery were both significantly shorter in the water delivery group. This is interesting because, on the other hand, the use of oxytocin was even lower in the water delivery group. As expected, the rate of episiotomies in the water delivery group was also lower. The rate of OASIS was, with 68 women, significantly lower in the water delivery group than in the bed delivery group with 125 OASIS. Because we didn't expect this result, we looked for the influence of potential risk factors for OASIS. We did some subgroup analysis, and I like to highlight two of the findings. The use of oxytocin in the second stage of labor showed significance. This means that the use of oxytocin in the second stage of labor increases the risk for OASIS in Primiparae independently of the birthing method. The birthing method itself didn't show significance. So the birthing method itself isn't a risk factor for obstetric anal sphincter injuries. With these data, we clearly show that water deliveries and bed deliveries are both safe and equally safe birthing methods, as long as they have an identical labor management. So the use of a hands-on technique in all deliveries is mandatory. Still, Primiparae after water deliveries have a lower rate of OASIS. We suspect that this is because they need less often oxytocin. Summing it up, a careful labor management with the hands-on approach in all deliveries might be a key issue in these results. Water deliveries in a hospital setting are a good idea to prevent obstetric anal sphincter injuries in full-term Primiparae, and so we have an option to prevent further pelvic floor disorders.